The Pre-Hospital Emergency Care Council has commissioned this DVD to standardise the approach to Objective Structured Clinical Examination, or OSCE. Specifically, the DVD will advise candidates on what is an OSCE, how to prepare for an OSCE, and the conduct of an OSCE and related quality issues. The Irish public expects its practitioners to respond quickly and provide pre-hospital life-saving care. Practitioner training is designed to impart the knowledge and skills required to operate in this difficult arena. Training is intensive and requires hard work and dedication to reach the required standard. All candidates must be issued with the NQEMT examination handbook by their training institution. You should read carefully the section dealing with the OSCE, particularly the difference between primary and secondary skills stations, and the section on candidates' conduct during the examination. Once the circuit commences, candidates are under examination conditions. Strict exam discipline must be observed, and candidates must comply with all instructions from the supervising staff or circuit coordinators. Remember, no phones. At critical points during the process, candidates are required to undertake practical skills assessments. FEC candidates are expected to be highly professional in their approach to these assessments in what is a high-stake national examination. Objective Structured Clinical Examination, or OSCE, involves the examination of skills in a predetermined and controlled situation. An assessment sheet is utilised that breaks the skills being assessed into constituent elements. OSCE station assessment sheets are available on the FEC website to guide candidates through the assessment process. Go to www.phecc.ie. Assessment sheets will not be changed within 60 days of an examination. Your examiner is provided with a tablet PC preloaded with the station assessment sheet. During the assessment, the examiner monitors the candidate's performance and confirms whether or not each element has been performed correctly. The assessment sheet is standardised to ensure that each candidate undertakes the same examination. Examiners will never deviate from the assessment sheet. The assessment sheet is provided as an assessment tool for examiners and is not intended as a study aid for candidates. Candidates should treat the OSCE station as a real-life event and respond to the situation presented. Candidates, therefore, should not learn off the assessment sheet by rote. The OSCE examination is a circuit of individual skills that are assessed concurrently. At each station, a different skill will be assessed. The circuit is controlled by a circuit coordinator. A series of voice commands direct the candidate's actions throughout the circuit. At the signal, the candidates are brought to their starting position.
Enter station.
Each station lasts 8 minutes. The candidate moves to the next station. There is a 2-minute rest period between each assessment where examiners return all equipment to the start position so that the next candidate has the same assessment start point. The candidate now begins the next station. Each assessment station door will be clearly marked with the assessment identification. At most stations, the examiner will read a scenario to you. On some occasions, however, there may be a scenario on the door. You will be required to read and be familiar with the scenario before entering the station. There may be a patient or an assisting practitioner assigned to a particular station. The examiner will brief the patient or assisting practitioner on how to react and respond to you during the assessment. At the beginning, the examiner will take and enter your details on the tablet PC. When you enter the room, the examiner and the station will be introduced to you by name. You will then be asked by the examiner if you are ready to proceed. Only then will the assessment begin. While each station is to be treated as a real-life situation, candidates are not expected to wear gloves during OSCE examinations. Communication between the candidate and the examiner will be friendly and businesslike. The examiner's role at this point is to confirm whether each element on the assessment sheet has been performed correctly. The examiner will follow the assessment sheet precisely and will not ask questions or create clinical situations that are not indicated on the assessment sheet. During the OSCE, the examiner will remain totally objective. The examiner will confirm with you that you are finished before finally closing the assessment record on the tablet PC. If there is time remaining, you may sit and prepare for the next station. The examiner may engage in general conversation. However, be careful not to discuss matters relating to the assessment or your service station. At some point during the assessment, a member of the Quality Committee will enter a station during the 2-minute recess prior to your entrance. Their function is to observe solely the performance of the examiner. FEC encourage candidates to actively participate in the internal quality process of the assessment by providing feedback. The Quality Committee carefully reviews all candidates' comments. Here is a short sequence of examiner and candidate interaction, along with some real comments from candidates.
Refs are 16 minutes.
This DVD has provided clarity on what is an OSCE, advice on candidates' preparation and setup for an OSCE, and information on the conduct of an OSCE and related quality issues. You as a candidate have trained hard to arrive at the point of assessment. The function of a FEC examination is to provide a competent and professional assessment. The reputation of the OSCE as a fair and equitable process has been established. It is of the utmost importance that standards be maintained by candidates and examiners alike.